Together we achieve victory over heart failure.
Hello friends, myself Dr. Shah. I am an interventional cardiologist working at Krish Heart Care Clinic, Ahmedabad. On the occasion of World Heart Day, I would like to give certain important points regarding heart failure and how can we achieve victory over heart failure. So heart failure is a condition which is basically developing due to damage to the heart muscle and ultimately leading to reduction in the pumping of the heart muscles, and that is the reason patients are developing symptoms like breathlessness, that means difficulty in breathing. Patients are developing palpitation, that means awareness of own beat, then sometimes leg swelling and nighttime difficulty in breathing. Patients can also feel a very important symptoms which is very early in the phase, and that is known as easy fatigability and weakness. All these things are basically leading to the development of overt heart failure. So these are the symptoms by which you can diagnose that the patient might be having cardiac problem. By doing a proper investigation in form of ECG and echocardiography, you will be able to classify the heart failure, the pattern of heart failure. Most of these patients are having some underlying heart disease in form of coronary artery disease or valvular heart disease, which can ultimately lead to heart failure. So to know whether the patient is having heart failure or not, we might require some better of investigation in form of echocardiography, which will give you the idea about the ejection fraction or pumping of the heart, or certain blood tests like anti-proBNP and certain tests which are required to diagnose the underlying condition of heart failure like diabetes, high blood pressure, obesity, arrhythmias, atrial fibrillation, and so on. So just to understand regarding some important numbers, how can you remember those numbers to make sure that you are having a good heart activity and you are not having any major sign and symptoms related to heart failure. So one must know your heart numbers in form of heart rate. So ideal heart rate should be in the range of 60 to 80 per minute. The ideal blood pressure should be less than 130 by 80 millimeter of mercury. When we are talking about cholesterol level, the LDL, which is a bad part of the cholesterol, should ideally be less than 100 and preferably less than 70 for all diabetic individuals. HDL, which is a good part of the cholesterol, should be more than 40 in males and 45 in females. HbA1c, which is a marker of sugar, ideally it should be less than 6 and preferably less than 5.5. Triglyceride should be less than 150 and fasting sugar should ideally be less than 110. And another important point or rather number which we must remember is BMI, that is basal metabolic index, and that is body mass index is basically ranging from 18.5 to 23.5, and all Indians should ideally be having BMI of less than 23.5, which is making them normal weight. So whenever the BMI is more than 25, the patient is turned out to be obese. So all these numbers required to be remembered to keep ourselves healthy. Thank you very much.